Welcome to the Medical Collective, your go-to podcast where medicine meets real life. I'm Dr. Keisha Davis, a pathologist, personal trainer, and your host. I will be joined by a vibrant team of doctors who are not just healthcare professionals, but artists, fitness enthusiasts, and advocates for change. Each episode, we dive deep into the world of medicine, from untold stories of the healthcare industry to the latest in medical advancements. We're here to bring your insights, answer your burning questions, and explore the art and science of healing. So let's get started and step into the world of the Medical Collective. Hello, and welcome to another episode of the Medical Collective with your host, Dr. Keisha Davis. I'm solo today, but this conversation, I think all of them end up being so timely, but now we need to talk about some serious stuff, and it's HPV. 3 letters. I'm sure you all are like, what is HPV? We're going to delve into it today. Most people hear about it and you think about cervical cancer. For women, when you get your pap smear, you think about HPV testing. However, I need you to understand something very clearly. HPV is the most well-established cause of cancer from a virus. One of the viruses that is directly causing cancer, and it doesn't just affect the cervix. Before we get started, I want to put out some common myths that are out there on social media, on these dangerous social media streets. Myth 1, HPV only affects women. It's a myth, so I'm going to explain why soon. Myth 2, if you don't have symptoms, you don't have to worry about HPV. Myth 3, the HPV vaccine is optional or unnecessary. Now, I know it's crazy. It's a sensitive time. We're talking about vaccines is uncomfortable to have. But as a healthcare professional and as a pathologist that sees cancer, I'm telling you it should not be an uncomfortable conversation. It saves lives silently, and it prevents you all having to have a biopsy or having a specimen come to the lab. So let's get into all of that today. We will unpack it. And I want to let you know, again, I'm a pathologist. So I am one who studies disease, and I diagnose cervical cancer. I diagnose HPV-related cancers, and I see in daily practice what happens when prevention fails. HPV is not just a woman's issue, it is a human health issue. So let's start with some basics. It stands for human papilloma virus. So many people are exposed to HPV, but the immune system clears it. So they don't even know that they have it or are affected by it. But when high-risk HPV persists, that's when cancer develops. And the numbers here are what matter. Approximately 99% of cervical cancers are caused by HPV, and about 90% of anal cancers are HPV-related. Yeah, imagine. Roughly 70% of oropharyngeal, or what we call head and neck cancers, are HPV-related. That's a pretty nice percentage. About 60% of penile cancers are linked to HPV, and about 70% of vaginal cancers are HPV-related. As a pathologist, I want you to know it's important to understand that HPV targets a specific lining, and that lining is called the squamous mucosa. The squamous mucosa. So the squamous mucosal lining that is present in many parts of your body is different than the skin, which is a squamous epithelium, but it has an extra thick layer to it. The mucosal lining is seen in your mouth. It's seen in the vagina. It's seen in the anus. It's seen in the throat region as well, and the penile region. All of those have the same mucosa. So the virus is loving to that environment. For some reason, it likes to adhere to that environment. That's why it's not just the cervical mucosa that is involved by HPV. Anything that looks like that, it's going to go to. It just happens that cervical cancer is the ones that we most target, and the pap smear is one of the best screening tools for it. When there is squamous mucosa, HPV can cause cancer. Remember that. Where there is squamous mucosa, HPV can cause cancer. That means men and women alike can get it. Yet it is still treated for some reason, like it's a woman-only disease and it's only about getting a pap smear. So I want you to know there are two types. We put them into two buckets, low-risk HPV and high-risk. Have you ever heard about a venereal wart or condyloma? Those are actually caused by low-risk HPV. Yes, they can cause these large, very uncomfortable, disfiguring lesions, but they are not directly linked to cancer. It's the high-risk HPV, which includes HPV 16 and 18, that causes dysplasia. And dysplasia is any abnormal change, abnormal growth, right? If you have a squamous mucosa, and we look at it under the microscope, it's nice, it looks regular, orderly. Dysplasia makes it change into a very irregular appearance, and over time, that can lead to cancer. We diagnose dysplasia with the pap smear for ladies. When you get your pap smear, that is sent off to the laboratory, and a cytopathologist looks at that under the microscope to be able to tell, is there atypical cells, is there low-grade dysplasia, high-grade, and also HPV testing is done, which I will talk about in just a bit. This is why early detection is important. So why and how do we actually detect this HPV/dysplasia? We detect it through molecular testing, which is done in the laboratory, and we're looking for the viral DNA or RNA. We detect the dysplasia, again, by looking under the microscope and looking at it. So there's two parts, and depending on what is your situation and what is recommended by the guidelines that gynecologists operate by, they will decide if you're going to start with doing the pap smear examination, which is looked at by the pathologist, and the HPV testing or HPV testing alone. And the distinction of whether it is HPV high grade or high risk HPV or low risk depends on what the doctor is going to do next. So you need to know if it's high risk HPV or low risk, and you need to know what I saw, because if I saw cancer, we're already in a different stage. If I saw atypical cells and not sure, and then the HPV testing comes back as low risk, we got to kind of decide what the next step is. Now, there is always a stigma somehow with HPV, and that's one of the cancers you don't want to talk about or share about. And I think that then prohibits people from going to the doctor and talking to them about this. And it also leads to a stigma on other HPV-related cancers. And one of them is anal cancer. As someone that has looked at it, one of the worst cancers I have seen actually was in a woman. And the stigma has always been that anal cancer is in a certain demographic, but anyone that participates in high-risk behavior or anal manipulation can get HPV in that region. And if it's high-risk HPV, it can lead to the same thing that happens in the cervix, which is dysplasia, and then sometimes cancer. Right. And if you don't know, or you're not telling your doctor that you are high risk for these behaviors at your annual examination, they won't know to then do the next step, which is to do an examination and or a pap smear of the anus. And yes, there is an anal pap smear, everyone. I have seen quite a few of them, and sometimes it's not very good news, but the good thing is that that person spoke up, got the anal pap smear, and now we can do the next step, because you don't want to end up having a metastatic carcinoma that could have been prevented. Usually in the anal cancers, we're seeing those at high-risk groups. Immunocompromised, people living with HIV, if they had prior cervical or vaginal dysplasia, or what we call the receptive anal intercourse. So I want you to understand it's not just one demographic, and don't be afraid to tell your doctor these things, because they're going to prevent you from getting the health care that you need. So a high-risk patient should tell their doctor, not because of judgment, but because of prevention. Please, please, please. Cancer waits for no one. I say that. Me as a parent, I may wait on my children. I give them a couple of chances, but cancer waits for no one. Hello, listeners. We want to remind you that you can catch The Medical Collective on all your favorite podcast platforms. That includes Apple, Spotify, and YouTube. Be sure to hit that subscribe button so that you never miss an episode. We're also on Libsyn, and you can find us on all social media platforms as The Medical Collective. Do you have thoughts or questions? Please don't hesitate to reach out. We love hearing from you. Now let's get back to the conversation. HPV is not immune to the gender or the sex that it can involve or affect. So men, you can get HPV, and there's two things that you need to know. One of the biggest myths is that HPV is a women's issue. HPV affects men. You've got it. Anyone listening, tell a loved one. HPV affects men. And any type of man. Men can transmit HPV to women. So a man, you can get HPV and get cancer yourself if it's high-risk HPV, but also you can transmit it to a woman and therefore she can get cervical cancer, and you'll never know. It's not like an STI that you normally see that has direct lesions. Remember, the low-risk HPV may cause the condylomas, but the high-risk HPV does not present as a wart, venereal wart. So you're not going to see those changes, and you're not going to know that you just gave someone this or you got it. Men also are at higher significant risk for head and neck cancers. A cancer, have you heard of anyone that's had a cancer of the tongue, of the oral region? Those are all head and neck cancers, and 70%, remember, can be HPV related. So I don't think men realize that they're at risk, and there's no routine screening for you. That's what's even more scarier is women, we have the cervical pap smear. We have the pap smear test. For men, we don't have a routine screening. And again, if you're not telling your doctor about your high-risk behaviors, or they're not asking, then you're not going to even get the anal pap smear or the other screening that you may need. So this is why the way to prevent it, since we don't have a routine screening like we have for colonoscopy, like we have for colon cancer, or for breast cancer with mammograms, that's why the prevention lies in the vaccination. It lies in the vaccination. It does not, HPV does not discriminate. Prevention does not care who you are or what you believe in. And that's why we have to start normalizing immunization and understand it so we don't deny it to our children. The HPV vaccine is one of the most effective cancer prevention tools. Cancer prevention, okay? We're not talking about, oh, I'm healthy, I'm not going to get COVID, I'm not going to get flu, I don't need that vaccine. HPV is a cancer prevention vaccine. It is approximately 90% effective, 90%. So that means most people that get HPV-related cancers did not get the vaccine. Routine vaccination is recommended for those between 9 to 12. I knew the assignment, so when my children were that age, I didn't say no. But I can understand, and I could see someone that doesn't understand this and someone asking them to give their child a HPV vaccine when they're like, it's a child. Why do I have to worry about something that has to deal with sexual? It's because the earlier you give it and on time, the more effective it's going to be later. This is like those who do college funds. You're getting ready, right? Early ahead of time. Your child's not going to college when they're a baby, but you're setting up for the future. The HPV vaccine is setting your child up for future, for their wife, their significant other, their husband, what have you. 20 years down the line, they are still protected. They don't have to get annual boosters, nothing like that. Now, it does come in a 2-dose system if you take it at the recommended ages. And then there is a catch-up vaccine. Now they've been extended it because up from 27 to 45, vaccination can still be done, and it's a shared decision with your doctor. If you've missed it or you didn't have it when you were a child, you still can get it. Don't worry. Under age 15, it's 2 doses, and 15 to older, it's sometimes recommended for the 3 doses. So I want you to make sure you're speaking to speaking to your own physician about this if you have any questions. Now, what I have noticed in the climate that's happened over the last year and a half has been a anti-vaccination rhetoric, and it's more so than hesitation now. It is now an almost fear scare, and the majority of it is led on disinformation. Nothing that we do in science is 100%, but we go by percentages. The risks of cancer are far more if you don't get this immunization versus the risks of getting something from the vaccine. It is a highly effective, highly safe vaccination for our children. And I think we are not understanding the cancer part. And January actually is Cervical Cancer Awareness Month, but I wanted to go beyond that because there's so many cancers. I'm just heard of someone that lost their loved one to head and neck cancer. And then I've seen this horrible anal squamous cell carcinoma. And all of these things, these people did not have the HPV vaccine. And I'm thinking, what could have been prevented if they would have just known, or if the disinformation was not ringing so loud in their ears that the facts from the physicians were able to push through. So the vaccine, again, is not about having intercourse or sex. It's about cancer prevention. I want you all to understand that, please. And even oral to oral, you can get HPV. Right? Because it can be in the mouth. So I want people to make sure they understand that. Now, we get to the good part, which is about testing. So you may ask, Dr. Keisha, okay, so how do I test for this? And there are some new updates in this field. HPV testing is very important. And when it comes to women and cervical cancer, we always think about the pap smear. Now, there are two caveats to this, and Dr. Sharon, for you all that know her, will tell you she's very adamant that a woman or a patient and the patient and the doctor need to have a visit together, a conversation. She needs to see them. A pelvic examination needs to be done, and that can never be replaced by simply an at-home test. There are at-home tests, HPV test, and it's a collection test where you're not actually doing a pap smear. You're not going to the cervix. You're just getting vaginal secretions, and you're collecting that and sending it off for HPV testing. Now, there's two fields. My field is that, especially now, getting into the doctor or the fear. If someone has a fear, the initial fear of just getting in, it's like sometimes people have the fear to go to the gym. If they have that initial fear, that at least being able to get the home testing and know if they're high risk or not is half the battle. Then we can talk about getting into the doctor and finishing the examination. I think that home testing is an additional option, just like Cologuard is not going to replace colonoscopy or seeing your physician or getting other testing, but it's a good adjunct to it. It does not replace medical care, especially if you're high risk. So if you're in the high risk group that I talked about, if you've had prior cervical cancer, any other type of squamous cancer or cancer in general, or dysplasia or abnormal pap, if you're immunocompromised, if you have symptoms that are concerning, you don't do the at-home test. You go directly to your doctor. So that's when testing alone is not going to replace a physical exam. Now, if you are wonderfully aging, ripening, and you're concerned, is it too late for me? Should I talk to my doctor? I want you to know it's never too late. It is never too late, that you can always ask questions. You can always ask if you are wanting to get the immunization, if there's something you may think you need to divulge. It's still important. Screening still matters. Vaccinations may still help, and the conversations with your physician are critical. Prevention, to me, is not, we have not perfected, right, preventing things. Unfortunately, we've got our genetics, we've got environment, and our social situation that combine sometimes to where it's inevitable that we'll have cancer. But I think that being informed, having a conversation with your physician is going to nip things in the bud before they become worse. HPV is the most common virus directly causing cancer. I want everyone to go away knowing that the HPV is the most common virus that directly causes cancer. Directly. So what can I do to prevent it? You can be informed. You can make sure that you have your immunization and your children, your offspring have it when they're recommended or later. Don't say, okay, I missed that deadline. You can still get it done. That's the most important thing. And also, it's important for you to have this conversation with your children, your family members as well. I'm sure somebody knows someone that's had cervical cancer, anal cancer, had a head and neck cancer. And I hate to hear the stories about we lost someone to cervical cancer. That should not be happening. I have a couple of friends that have lost a loved one to cervical cancer. In the day and age where we have screening, where we have vaccinations that prevent over 90% of them, and we have the information available, the testing, the surgery, what have you, we really have to start to listen. I am a physician. I made sure my children were vaccinated. I encourage my loved ones to get vaccinated, and I'm encouraging that for you. I'm doing and practicing what I preach, and I also have seen cancer, and I do not want to see another case. I don't. So I hope that this information is something that you can take with you. Talk to your physician, ask about vaccination, ask about screening, and if this episode made you think differently about prevention, I want you to listen to the episode. We should not be cancer shaming. And as a pathologist, I want to prevent them. I want to be able to no longer see cancer under the microscope. I know that's my job, but it would serve me greatly to be able to say, I no longer see cervical cancer or HPV-related cancer. So I want to prevent them, and I want you to be empowered. Until next time, have a great day. Thank you for tuning in to the Medical Collective. We hope today's episode has left you with valuable insights and a new perspective on healthcare. Don't forget, follow us on social media for more updates and behind-the-scenes content. I'm Dr. Keisha Davis, and it's been a pleasure to share this time with you. Stay healthy, stay informed, and we'll see you in the next episode, where medicine continues to meet real life. Please note that the content provided in the Medical Collective podcast, including text, graphics, images, and other material, is for informational purposes only. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The views and opinions expressed on this podcast are solely those of the individual authors and guests and do not represent those of the Medical Collective, its staff, and any affiliated entities. The appearance of content on the podcast does not imply an endorsement. Neither the host, Dr. Keisha Davis, the co-host, or any guest of the podcast bear responsibility for the accuracy of the content provided or the use of information received through the podcast. Reliance on any information provided by the Medical Collective podcast, its employees, writers, or guests is solely at your own risk.